everybody, Dr. Anjana Bhanu. This is Mark. This is Dr. Mark Opperman. Thank you for joining me again on my YouTube channel. I'm super stoked. We've just finished the Sculptra launch and I'm so happy that you're here chatting to me, Mark. And Mark has been using Sculptra for the past, what, like year?
6 months.
6 months.
Yeah,
and
it came to South Africa in October of this year when some of us were privileged enough to start using this product.
Yes.
For me, it's a game changer.
Okay.
It's an absolute game changer. Anjana, you and I have been in this industry for so many years, and we've seen it all, we've done it all.
Yes.
We've trained on different products.
Yes.
This is new, it's innovative, it gives the patient something that's one, natural,
Yes.
gradual in onset, and long lasting.
And I think, Mark does a lot of male aesthetics. Mark also heads up something called the T clinic, so the testosterone clinic. So, and you see a lot of men. In terms of men having these treatments, are they more open to it? Because, it's not a obvious initial, okay.
Absolutely. I think for men, the last thing that they want is an obvious sign that they've done any kind of treatment.
Yes.
I've had the treatment done myself.
Okay.
Now, I've had 2 sessions done. For me, what's improved was my nasolabial lines and my jowls.
Okay.
So my skin quality is better. I have acne scarring, and my acne scarring is gone.
Wow.
So, for men, this is a wonderful treatment. If you're starting to feel looking down and everything sags and falls forward, this is a beautiful treatment, and no one will ever say that you've had it done. Okay,
and then currently, is this your favorite treatment? What is your favorite treatment?
This is my favorite treatment.
So this is your favorite treatment?
Yeah.
Okay, all right.
I've been talking about this ever since we had our training as trainers in October.
Okay.
In June, actually, we had training on this in June last year. For me, it's changed the way that I use fillers in my practice. It's changed the way that I treat skin in my practice.
Okay.
So for me, absolutely, this really is my favorite treatment.
Okay.
It's safe, it's painless, and the results are mind-blowing.
And I think that's the anxiety factor for us as aesthetic doctors is safety, because we're always worried about, even though it's a rare complication, vascular occlusion from hyaluronic acid, but also, Mark, we just touched a little bit on your T clinic. So can you tell me what else? Well, like, I know there's the external aging, but what sort of other things do you do at your T clinic that helps from the inside?
So the T clinic is a specialized practice that work on hormone optimization and sexual functioning. So let's just look for both men and women what the changes in hormones does to the skin.
Okay.
We know, for instance, when estrogen level starts decreasing in women, that they start presenting with dry skin, the skin starts sagging, etc. What a lot of us don't know is that we make estrogen from testosterone in both men and women.
Yes, okay.
So optimizing hormone levels, not necessarily replacing them, just optimizing them through the use of bespoke IV nutrients, supplementation, hormones, whether they are transdermal or injectable, not only improves the well-being of the patient, but the quality of life. And when quality of life improves, all our patients want, oh my God, I'm feeling so great, now I want to look great.
Yes, okay, great. Thank you, Mark.
It's a pleasure. It's always good to see you.
Yeah, so thank you for your time. And Mark has an amazing amount of knowledge, an amazing amount of experience, an amazing amount of calmness while treating the patient as well. So if you want to look up Mark, it's at the T Clinic?
www.thetclinic.com.
And then on Instagram and you also have like a podcast or podcast slot?
We have a weekly podcast on Cliff Central.
Okay.
At 9 o'clock on Wednesday mornings. It's called the T Health Show.
Okay.
And this week, actually, we're going to do a podcast specifically on Sculptra.
Okay, great. Okay, so thanks, Mark. So thanks, everybody. And if you want to know more about what we've been discussing, catch Mark on his website or social media channels or his podcast. If you have any questions, drop them in the comments down below. Like, share, and subscribe. Bye. Thank you.
Thanks.